Joanne Wilson, and this is Positively Gotham Gal. Real, honest, and meaningful conversations with women entrepreneurs about their approach to life, business, and everything in between. So let's start. Well, thank you so much for coming on. And this is a quote that you said, which I absolutely love. And I think today is more important than probably any other time based on what's going on in America and down in Texas, which is early on, we were colloquially known as the Uber of birth control because our focus on making birth control accessible for women. And I just love that because, I do believe that if men were the ones having children and, they still were the men, none of this would be an issue.
Yeah, so just to, first of all, thank you, Joanne, so much for having me on the show today. It's really a pleasure. Nurx from the very beginning has been focused on increasing access to healthcare, but more specifically, we did start off as, we were dubbed the Uber for birth control because the initial problem we were looking to solve was the 19.5 million women who live in contraception deserts in this country and for whom contraception is incredibly hard to get access to. And we knew that telemedicine and asynchronous telemedicine in particular could offer a unique solution. And what was amazing is that, as soon as the company launched, I was an early investor in the company.
That's right. So what made you be that earlier investor in the company? And you were doing angel investing at that point.
I was doing angel investing. I had learned about Nurexs from a friend, and I just felt so drawn to the problem and the impact that could be had, and knew that even at that time and believed in the founder's vision that this could end up being a true diversified healthcare platform for women, but starting off with a problem that is so acute, like access to contraception, felt really powerful. So I was so excited to be able to be part of that early investment and really be an advisor to the company. And then, honestly, it's been incredibly humbling, and I'm so grateful to have been able to, then step up to be the CEO in April of 2019.
Which is pretty amazing. So you founded your own company earlier in your career.
I did. That was a long time ago.
And what was that company?
Yeah, so back in 1998, in the first .com, I started a company called Eve.com, which was, we were the first online cosmetics e-commerce company. And so back then, believe it or not, cosmetics being sold online was not a thing.
Well, nothing online was a thing yet.
Exactly. In fact, the only things online were really books and computers. And, some of the early questions we got from investors were like, will women shop online? And things like that, which was, now you look back and you think, well, that's ridiculous. But yeah, so that was my first foray into entrepreneurship. It was a wild, crazy, wonderful experience. And, we had a nice exit in 2000. And then after that, I just really felt like I just wanted to be part of innovation for the rest of my career.
Got it. And innovation being working in companies versus starting a company.
It didn't turn out like I wasn't probably as planful as I should have been.
No, you know what? I'm not so sure about that. I've never planned anything.
And it's true, a lot of people who are, they're entrepreneurs, they have a successful exit, they go on and they start their next company or the next company. I felt a little bit differently. I was just about to start having children. And that was one element where I just wasn't sure I could balance, starting a company and, that part of my life. The other part really was, I wanted to learn how to be a great leader, and to learn how to lead. And the reality is the 2 years when we were starting and running Eve, it was every day was a fire drill. We were working 18 hours a day, and it was crazy. We did a lot, we learned a lot, and it was successful, but there wasn't a lot of time to like sit back and reflect on like how do you lead. We didn't have that many. We were my co-founder and I, we were both co-presidents, co-CEOs, so I didn't have many like mentors or anything like that in the company. So I wanted to go and work for a leader and really learn, and that's why I went to the Gap for 4 years. I ended up working for this great guy. His name is Toby Lank. He had been the founder of eToys, so he had been an entrepreneur. He's this brilliant, kind of eccentric, crazy, wonderful guy, and I learned so much.
Well, retail teaches you. I mean, I started my career in retail, and what's interesting is what you talk about children. I think that is always the elephant in the room with women, and I understand because I had the ability to start my own business in the garment center. I had money. I had people who wanted to give me money, and I was just like, God, I'm afraid if I do this, I will never be present in my children's lives. And so, the road is long, and I'll figure out when the time is right for me to do that. But it isn't now because it is, a 24/7 world when you are growing a company. And even the first couple of years, you're like your head is in the weeds. It's so hard to rise out of those weeds. Now, what did you do at the Gap?
Yeah, so I started off kind of tapping into my consulting roots because before Eve, I had been at McKinsey for a couple years. So I was the head of strategy for the outlet division. And then I ended up being a merchant for Baby Gap, which was very appropriate.
Nice.
And that was a lot of fun. But ultimately, like my dream job there was when I was VP of OldNavy.com. And that was just a really great intersection. I got to work for Toby. It was e-commerce and it was retail, and it was fun, and I learned a ton.
I'm sure you did. I mean, at the end of the day, for me at least, retail still is the foundation of really everything that I have grown on, because it is a business that every day you look at your numbers and you think, that was a good day. And if it was a bad day, what are we going to do in the next 24 hours to change it so that tomorrow is a better day?
It's super exciting, and especially at a place like Old Navy, which is it's mass, and it's really in like the part of the fabric of the economy. You get to see what's the mood of consumers across the country. And in general, I would say I've always wanted to be a part of things that were at that accessibility level. I've never been attracted to kind of like the luxury segment or really niche areas because I really have always wanted to work on things that have broad impact.
For sure. I mean, there was a saying in the Garment Center, which was, if you want to hang with the classes, you got to sell to the
Yeah,
masses.
that's right. And even cosmetics, that was, one of the things we really liked about cosmetics, and I still love about it is it's really accessible to everyone.
Absolutely. Everybody can have a lipstick.
Exactly.
100%.
But there's also a lot of need for innovation, right? Retail is really hard. It's not an easy business. So many things are happening. And that's where, everything from unique merchandise and brand and even I think the e-commerce experience is critically important these days because, I look at our children and they're teenagers and, you know, convenience and delivery, next day delivery, and all of that is as important as sometimes the brand, depending on what it is.
The user experience. If I have a bad user experience, I just opt out, very quickly. It doesn't take long to figure it out. So after you left the Gap, is that when you went on to Clover Health or Airbnb? Which one came next?
So I actually moved to Asia for 5 years. Lived in Singapore. We had a really great kind of family experience there.
I'm
My
sure.
husband had the opportunity to work there, and then we moved back in 2013. And then that's when I took on the role at Airbnb.
So what did you do when you were in Singapore?
I actually worked for Singtel, which is a big telco. I worked there for a couple years, and then I ran international for a company called Living Social, which was a daily deals company.
Yeah, I remember Living
Yeah.
Social. That's
So I
great.
got a really broad international experience from those two experiences. And so when I came back, Airbnb was just an amazing fit. It was, it's global in scope. It really has an incredible mission around connecting people and, helping you really see a different side of cultures. And I had felt like I had really experienced that living abroad, and I wanted to continue that. And so it was great. I was head of global operations. I had a really great, interesting role. It was the country managers and city managers around the world. So I got to meet and work with great people. And then also, service delivery, like customer service and trust and safety and all you know, the operational, the nuts and bolts of the service delivery, which is also really important.
Yeah, completely. I mean, the thing about Airbnb, which is so right time, right place, is for a next generation that wanted to be global citizens and feel that they could travel and see the world in a different way. My kids, when they travel and I would consider them global citizens, they always use Airbnb.
I'm of Indian origin, and my parents grew up in India. They came over here in 1965, and my mom came in 1969. So I grew up going back to India to visit their parents and my relatives, and so I've been fortunate to be able to travel at least to India and some places around there. And I always felt like I had a different perspective on the world than some of my friends that I grew up with here, because I was born here, who had really not had the opportunity to travel that much. And so I think Airbnb does a great job of trying to enable that for everyone and make it accessible.
I agree. I mean, God, and growing up outside, our last stop was outside in Maryland, which is right next to DC. And I had friends who literally had never been downtown to DC or Georgetown. It was 30 minutes from our house. And I just think it's a mindset of a different generation, right? I mean, most people don't go farther than where they grew up. So then Airbnb, when did you go to Clover Health? When was that move
So
made?
I left Airbnb in 2016. It was I was there for almost 4 years. It was an incredible ride. I traveled a ton, and I was really burnt out. And so I took about 7 months off in 2017, and that was great. I did some traveling myself, but on a different pace. And then I had met this entrepreneur over the course of those months who was in healthcare, and I really didn't know what I was going to do, but I did have this sense that, hey, Airbnb was such a wonderful experience. Like, what do you do next? What can be as meaningful? And I met Vivek Garipalli, who's the CEO of Clover, and I was really inspired by what he was doing. And I thought, well, healthcare is incredibly important, and that it has a mission that kind of is up there, if not more inspiring in some ways. And so I joined as the COO in September of 2017 and just dove right in. There was a lot I didn't know. It was my first healthcare experience. I never really imagined myself in healthcare, and I learned a ton. And so, yeah, that was how I got to Clover.
That's amazing. And um, when Nurx came knocking at your door, I'm assuming that you continued to keep up with what's going on there after you put the money in and saw the traction the company was getting and how quick it was growing. And what was it that made you jump ship? I mean, I'm sure an incredible opportunity as well as a great experience.
So it was a little, yeah. So first of all, I had kept in touch with the founders from 2016, and I knew that there was tremendous growth. It was really exciting, and so that was always something that I loved to learn about what was going on. I also had this realization after I'd been at Clover for a little over a year that, hey, healthcare is really interesting, but it's also huge. And I think I've landed myself into like one part of this, like potentially this huge ecosystem. And I'm not sure this is exactly the right spot for me. Medicare Advantage is, my view, it's a really well designed program. Um,
Hmm.
but in general, that part of the market, it's a 10-year, 20-year, 30-year journey to really make impact. And I really wanted to be in a place where I could make impact faster.
Right. Well, that makes
I left in January of 2019. And I told the founders of Nurx that I was leaving and that I didn't know what I wanted to do, but I wanted to explore and, just take some time. And they said, well, why don't you come and consult for us? And they actually wanted me to consult in dermatology, that they were looking at dermatology. And because I'd been in cosmetics with Eve, I'd always have skincare in general. I feel really I'm very passionate about. So I said, sure, that'll be fun. I'll come and consult 2 days a week, and then I'll leave other time open for exploration and things like that. So I started to come in, and it was just kind of this interesting thing. I fell in love with the company, and I think they got to like me. And, a couple months later, the founders and the board asked me if I would be open and interested in taking on the CEO role.
perfect. And so, you know, how it started out was more about delivering products to women across the country that were in need of birth control. But how has it grown? And when you think about this as a mission-driven company, like what does that mean exactly? Like what are you guys looking to do up in the clouds?
I would say our North Star vision, 20 years from now, is to fundamentally reimagine access to healthcare. Access and outcomes to healthcare are incredibly poor today, and we feel like we can play an incredible role in unlocking that. So that's like our 20-year North Star. Today, what we're really focused on is making expert care accessible to patients across her life stages. And so there's a couple parts of that. So one, we offer care in a number of different areas, but we go really deep, and we really aim to have this focused concentration of care so that people feel like they're getting almost specialist quality of care, but making it very accessible, especially economically. Um, so whether that's contraception, dermatology, migraine, sexual health, these are all areas that have, challenges from a costing perspective, a shortage of, providers. You can't get in to see folks necessarily, and even stigma. So we want to make
Definitely stigma.
exactly. So expert care is our orientation, and then making it accessible across those different barriers, and then helping our patients as she grows and ages. Today we're the largest women's digital health platform. From a number of patients we serve, as well as our revenues. But really, and so when you think about our age range, we start with patients in their like late teens and early 20s, as they are getting onto contraception. But we're there for her when she has sexual health needs, whether it's herpes, STI testing, some of these areas. She told us she needed support there. And so that was the impetus for us to go into some of those areas. And then we've been really close and connected to our patients, and that's how we've gotten the inspiration to keep expanding into these new areas, because it's based on what our patients are telling us that her needs are. And that's basically how we've evolved from kind of a one point solution for contraception to now a health platform across these different areas.
Which is That's a one conversation I've had multiple times with founders or CEOs when there's so many stories of people foisting their ideas on their startup or their company that they believe this is what should happen. And I'm always say, well, we have this many people using the platform. Why don't we ask them?
Yeah,
I mean, doesn't that make more sense? They know more than we do.
exactly.
And so as the company has grown into those different essentially verticals, although women's health being the large umbrella over the top, are the majority of these people in more rural and suburban areas than urban areas, or is it all over the place?
So it's definitely all over the place, but we do see interesting concentration. So About 40% of our patients are from the South, believe it or not, which is really unusual for a health tech company.
That actually doesn't surprise me when it comes to stigma.
Yeah. So in our definition of South, we include Florida and Texas. So it's a little bit broader. But yeah, the combination of stigma and contraception deserts and access to care is I think has been why services like ours get, we've gotten really good adoption. It's like 20% on each on the coast, and then the rest is the middle of the country. But we're really proud of that actually, because it shows that we can help in terms of people who really probably need the access more than others.
Totally. Are you finding that Texas, any changes in Texas, since they have decided to go against the federal law of women being able to have an abortion?
Yeah, so we have seen that emergency contraception in particular has grown in terms of demand. So
That makes sense.
we see 100%, 180% increase in requests to have emergency contraception, what we call on hand.
Hmm.
And I think it's a direct response to people wanting to feel more in control.
Yeah. I mean, I would want to feel in control too, particularly if you don't have the means, because essentially what they're doing is making it harder for women that don't have the financial means to control their bodies, which is beyond. And during the pandemic, what did you see in terms of change? And by the way, we're still in the pandemic. Just want to note, but it does seem to be getting better. Did you see major change? I mean, certainly the thing that I always love about healthcare as well as education is there's no one golden ticket. There are hundreds of them. So, and many of these companies, particularly like Nurx or education companies, seem to have just amplified, during this time period. They should have all along, but they were almost like pushed into, off the diving board because there was no
Yeah,
choice.
so we saw huge demand like everybody else did, which is, we were, it is hard to believe it's like 18 months now that we've been in this, and it is getting better. But in those first weeks and months, I think everybody was anxious and panicked. And there was, you go back to thinking about those days, and I think people really just didn't know what to do. We saw our highest request volume, what we call request volume, in April, May, and June in the history of the company. And it was, a combination of people wanting to make sure they have access to contraception and the other services that we offer. Cannot get into a provider, and rightfully so, providers were really only seeing emergency and critical cases. And so I felt it was all hands on deck for months and months. I feel like our team they worked really hard, but they were not in the same way as a frontline worker, but we felt like maybe we were doing our small part in the being able to relieve load onto the health from the healthcare system.
And I would assume that a lot of those people that reached out to you during that time period has realized, wow, this is a whole different way of my healthcare. I kind of stick with this plan.
So exactly. So, I would say pre-COVID, when I would tell people about what I did or explained, there was always this aspect of, well, is it legit? I've gotten many probably less nice words than that. But
Who are the doctors on the other side?
yeah, exactly, and what kind of doctors and are they real and all of this. And so telehealth and telemedicine has really gone from what I view as like a second or third option, like option of last choice, to a primary venue or avenue of care. And I think that has been game changing. And the trust that people have, either because they used our service and therefore we see a lot of people who came on through the pandemic who obviously continued with us, and then even even if they didn't use us, they're now just more comfortable with telemedicine and telehealth, and that just helps everybody in the whole industry.
100%. And certainly the cost of medicine in our country is just exorbitant. And there needs to be competition, and there needs to be better marketplaces. So, how about for yourself? Like, you joined this company before the pandemic, probably didn't see this coming. And, what were the silver linings that you got out of this? What surprised you over the last 18 months about yourself? I mean, you've had such a interesting, varied career. And I think that it's been a very weird time the last 18 months.
Yeah, so I think that well, I learned a lot about myself as an individual, and I think from my perspective, life is fundamentally different going forward than it was before.
I agree with you. I think we've taken a turn down a very new road. I'm not sure where the road's going, but there's no doubt we're on a new one.
Yeah, so I think a couple of things, and some of these were, are really, I think, interesting for women. Not all positive, but not all negative in my view. So, for myself personally, we got to spend a lot of time together as a family in the house, which was really nice. Our son just went off to college, so it was the last year. We got a puppy. We never thought we
You and everybody else.
exactly, like that was never in the game plan. And so it really just, we got quality time together. That's been amazing. Personally, I've been able to really build a workout routine. I work out every day now. um, I will never go back to not. And that's game changing for me, because at 51, I do need to really think about all the health stuff that is that everybody else has to think about. And I think about it a lot. And so that's been great, game changing. When I think about now, when I look, and then last thing I'll say is about our team, you know, and then I'll come to the point more broadly. But, we've moved to a largely hybrid slash almost all remote for most of our team, other than our pharmacy team, but our customer experience team, our RN team, and then our teams that were historically based out of San Francisco, like marketing and engineering and product. All those teams are either fully remote or basically remote, and you can come in if you want. So like very flexible. And I
And do you think that people are going to, as we're turning a corner, do you see that changing? That people are all of a sudden going to come back to the office 5 days a week?
never, never.
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 I agree.
So if you have a choice based on your type of role, our customer experience and RN team are going to be fully remote. We've already made that decision, and they're so thrilled for that. And I think prior to the pandemic, I don't think I would have had the confidence to believe that it could be done well and successfully. And now it's just I totally realized that I was wrong, and it's been a great experiment, and they've done incredibly well.
Well, it's sort of in line with who would have thought we would be talking to doctors or pharmacists like this, and then having my prescription come to my house the next day from a delivery person.
Exactly. And then, for the folks who are, maybe in different kinds of roles where it's a little bit more hybrid, we see desire to come in, for offsites, for collaboration, maybe once a week,
Totally.
maybe twice a week. But, we've been open since July and August. And we have, a handful of people that come in. And so, I think people really are finding that remote can work really well. I do believe in my team, my directs, we all agree that doing the offsite work, like the strategy planning and that kind of stuff together, is a lot more meaningful. And so I want to make sure that we protect that and plan for that. So we'll do that probably quarterly, if not more frequent. Uh, But other than that,
Well, that brainstorming kind of thing,
exactly.
it really, or just to say, can I grab you before that we leave the room, right? Those kind of things, very hard to do online. But the one thing, I mean, you started in 1998 in the business. I mean, I started in the tech world in 1996, and I, obviously naive, felt that the Googles and Apple and Facebook were going to change the way that we fundamentally worked, and it would be so great for women because they could be home when they needed to be home. Because if you're committed to your career and your job, you're going to get the job done. It's just a matter of how you do it on your time. And none of those companies did that. And but now I feel like the COVID has forced them to do it, and I really do think it's great for families and particularly mothers.
Yeah, so that's where I was going. I agree 100%. And, a small anecdote, when I took the role at Gap, before that, I was actually interviewing for roles down in the Valley as well. And I was 8 months pregnant, driving down to San Jose to meet someone at eBay. And I was thinking, God, I guess I kind of hope I don't get this job because it's so far and I just don't know how I'm going to manage it. And I was overwhelmed. It was our first. And, you know, so I really didn't look. I mean, I missed out on a lot of great companies that were down in the valley because, we had made a decision to live north and I had a house already and I didn't think I could manage it. And being a mom of one, then two young kids. And so, I loved my Gap experience, but I definitely missed out on some of those big, amazing companies because I didn't think I could do the commute. And I think that, I had always felt, uh, I remember saying to more than one person, including my sister, like, I can't wait till I really have made it so I can work from home on Fridays and really feel confident enough to ask my boss that I could do that. And I never, ever, ever felt like I could do that.
Interesting. Well, you've certainly had an incredible career, and I don't think that there was any missteps by not taking those jobs in the valley.
So, but I do hope it
It was
gives people,
fun.
women in particular, it gives them like they don't have to feel guilty about, working from home. They don't have to feel like, they are, you know, trying to get away with something. That doesn't have to have the stigma attached to it because,
Yes,
there is a lot of that stigma out there. Has been
there's
historically,
lots
there
of it.
was.
There was, and there still is. I mean, a couple of years ago, I remember a young woman came in my office who went on to venture, and she was at Cornell, and they had a program where women would come in and talk to them about what they're doing. And it was this one particular woman that came in and talked to them, who was a big banker, very successful banker, and said, when you go to work, you have to understand, if you have children, when the men want to go to their children's soccer game, everyone applauds them. When the women, you can't go, or you have to come up with a different thing, like it's a doctor's appointment or something like that. And I said to her, I mean, of course, she's like 21 years old, right? Senior in college. And I said, no, you have to be able to also say, I am going to my kid's soccer game because you're doing such a great job that they will respect you for that. And there is something in women, and I think it starts at a very young age, where men feel they can do that and women don't.
Yeah, I'll be honest. I have been told that I'm pretty courageous about a lot of things, and like I remember my boss Cynthia Harris said that to me back in, like, I don't know, 2004, and it's always stayed with me. Like wow, like that's pretty cool to have your boss say that. Um, I never felt like I was courageous about that. I never felt like I could. I've never felt like I could because I felt like I would be judged.
Yeah, yeah. I guess maybe that is it. Maybe it's being judged. But
So I'm so happy for people now. I think it's a new, it should be really liberating, and it should make it so much easier for families for the next, like, the next batch, the next generation. I'm really thrilled.
Great. I am thrilled too. They can have a child. They can work for a time. They can get online. They can call Nurexs. There's a doctor on the other end or a nurse. They can order all the products. They don't even need to leave the house.
Exactly. Exactly. Exactly.
Perfect. That's the
So
future. Well, thank you so much for coming on. I just love to hear about your career. It's insanely impressive. And what's happening at your company is just the future. All
thank you
right.
so much, Joanne.
All right. Thank you. And we will get together live.
Yes, take care. Bye bye.